Hi team, We Run Physio, Megan here. Today I want to talk to you a little bit about a condition called a proximal hamstring tendinopathy. Now this is quite literally a pain in the butt. People often point to their butt and say they're having buttock pain, and it's usually around that. If you sit on your bum, if you sit on your hands and you move your butt cheek, you can often feel the bones of your bottom, and it's usually around that point. It's not a general pain, so people will not describe it as kind of like it's here. It's normally like a 1 to 2 finger pinpoint around that buttock area. Now, people experience this because there is some sort of overload within the system. So that tendon gets overloaded at some point, struggling to cope with it, and we get this tendinopathy, just sort of like we would get with our Achilles. It can be really painful to sit on. People often find sitting really uncomfortable, any kind of bending over and uncomfortable. And that's because it compresses the tendon around that bony point on your bottom. And that is really uncomfortable. So the first stage is often to try and reduce that irritation. So we try and limit the amount of time we spend sitting. We try and reduce those compressive factors because really we need to take away the irritation, let the body do some of its work naturally before we then start to build back the capacity of that tendon. So some things that we can do include some isometric glute bridges, and we can build those exercises up so that maybe we do a 30-second isometric glute bridge. We then might build up to 45 seconds or a minute. We then build up the sets that we do. We would then progress that to single leg. And if we start to move our heels away from us, then we can challenge that tendon a little bit more. So just a whistle-stop tour there on proximal hamstring tendinopathies, but something that can definitely occur and just is a differential diagnosis to some buttock pain, which often is diagnosed as sort of sciatica, whereas actually it might not be, it could be a proximal hamstring tendinopathy. If you've got any questions on that, then please put a comment below. Otherwise, happy running.